Hello. This month's psychiatric nurse education topic is going to be adverse childhood experiences. So, the learning objectives are to distinguish between the different types of adverse childhood experiences, identify how adverse childhood experiences can impair the developing brain and affect later health outcomes, and describe how maltreatment can impair stress, resilience, mood regulation, and impulse control. So, what are adverse childhood experiences? They're also called ACEs, and they include a variety of traumatic events that occur in childhood. This can include certain situations like experiencing violence, abuse, or neglect, witnessing violence in the home or community, having a family member attempt or die by suicide. It can also include the child's environment. So there could be substance use problems in the home, mental health problems in the home, instability due to parental separation or household members being in jail or in prison. And ACEs are linked to chronic health problems, mental illness, and substance use problems in adolescence and adulthood. And ACEs can also negatively impact education, job opportunities, and earning potentials. And these are some of the things we're going to talk about in the discussion today. Okay, so the ACE questionnaire. So there are there is this questionnaire and it has 10 questions. And when a person fills this out, they answer yes or no. If you answer yes, you get 1 point. And it's important to note that it's not the number of each event. It's just, did it happen or did it not happen? So you can have a total score between 0 and 10. So there are 5 categories of household dysfunction. These include 27% of people grow up with someone in the home that has substance abuse, 23% have a loss of a biological parent when they're less than 18 years old. This could be to death, suicide, murder, divorce, separation, abandonment, foster, or adoption. 15% of children experience depression, suicide, anxiety in the home by a family member. 13% of children experience domestic violence of the mother, and 5% of children have incarceration of a parent. There are 3 categories of abuse, which 61% of people score at least 1 in these. So 28% abuse by a parent, 22% have contact sexual abuse by anyone, and 11% have psychological, emotional abuse by a parent, such as humiliation. And then there are 2 categories of neglect, which are found in 25% of children. So 15% is emotional neglect and 10% is physical neglect. Just to give you some numbers. So ACE score is not the number of events, it's the number of categories. So we just talked about that. So it wouldn't be how many times were you physically abused. It's were you physically abused or were you not? If you were, you get a point, even if it just happened one time, because one traumatic event can have a significant impact. All traumas have equal impact of outcomes in adulthood because you're getting 1 point for each 10 of these questions if you answer yes. And we have to remember that often these come in groups. So, for example, if a father abused alcohol, they'd get a point for substance use, but then he got angry and physically abused the child. So now you're also getting a point for physical abuse, and then would pass out and there'd be no dinner. So there's also a point for neglect. So now this child has an ACE of 3 just from that. So how adverse childhood experiences work? So we have the adverse childhood experience, the abuse and neglect, or the household dysfunction. It then impacts the child's development. It has a combination of neurobiological effects because of stress hormone dysregulation or brain abnormalities. There is a psychosocial effect, such as poor attachment, poor socialization, poor self-efficacy. There can be a health risk behavior, so, increased risks of smoking, obesity, substance use, promiscuity. And we're going to see examples of this later in the discussion. And this is going to lead to long-term consequences. So different diseases and disability, higher rates of major depression, suicide, PTSD, drug and alcohol abuse, heart disease, cancer, chronic lung disease, sexually transmitted diseases, and intergenerational transmission of abuse, as well as social problems like homelessness, prostitution, criminal behavior, unemployment, parenting problems, high utilization of health and social services, and a shortened life expectancy. And we're going to see more information about this further in the discussion. So first, let's talk about the origins of the ACE study, because it started in an interesting way. It started with this patient. There's a picture of her here in 1985 in an obesity clinic. So her original diagnosis was morbid obesity. And this clinic was looking at reducing weight. They weren't looking at traumas and childhood experiences. They were looking at weight reduction. So this woman was able to reduce her weight non-surgically by 276 pounds in 51 weeks. Now, that's great. That's fantastic for her. As we can see here, she went from 408 to 132. That's great. But what this did is expose the real problem that started the ACE study. So at her reduced weight, she was sexually propositioned by a much older man. So we can see here on the right side, her weight started up here at over 400. After 51 weeks, she dropped down here to that 135, where she stayed for a little bit, and then her weight started shooting back up. So what triggered this event is, like we just discussed, she was sexually propositioned by a much older man, and she then regained 36 pounds in 3 weeks. So upon further examination of the situation, she revealed a history of childhood sexual abuse by an older male family member. And this was the start of the ACE study to determine the long-term effects of childhood abuse. So the person that was conducting this obesity study saw that she regained this weight very fast and started looking into as to why. And his name is Folletti, and he is the one that started this whole ACE study. If you Google him, there's a ton of information on it. So we started looking at the history. Why did this happen? Why is she gaining this weight so quick when she was doing so well? Then found this history of childhood sexual abuse. And then he wanted to start looking into the long-term effects of childhood abuse. So the thing to know about childhood abuse and neglect is that it is common. According to the CDC, at least 1 in 7 children have experienced child abuse or neglect in the past year in the United States. This is likely an understatement because many cases go unreported. In 2020, 1,750 children died of abuse and neglect in the United States. All right, so talking a little bit more about the ACE study. So this was a landmark public health study by Kaiser Permanente, led by Folletti, and the CDC, led by Anda, between 1995 and 1997. It was the largest of its kind, with 17,337 adults with a middle-class sample. Now, the reason this is so important is because when we're looking at studies, the more people that are studied, it's going to give you better results, right? Because you're looking at a lot of people. You're not looking at 4 people, right? Because if you have 4 people, if you have one of the 4, you say, oh, it's 25%. That doesn't really hold up. So this is very important that they're looking at 17,337. The other thing that's important is that they're looking at a middle-class sample, not looking at low-income individuals or only wealthy individuals. They're kind of looking at a middle sample, which is also important. Now, the other thing that makes this study so reliable is that researchers were able to look 50 years back, but then follow people 25 years follow-up later. So they had the original time they met with them, they were able to look 50 years back, and then they followed up 25 years later. This is looking at a very broad timeline. It's essentially looking at almost someone's complete lifespan. So it's giving us so much information to support the statistics and the charts that we're going to see later. And it's important with research to be able to identify if a study is a strong study. It's Sometimes we see research gives us results, but it may not be a strong study. So the purpose of this is that this is a strong study. The research really supports these findings. And there have been over 80 related studies since this has been published. It's an internationally recognized study, and it reveals a powerful relationship between our emotional experiences as children and our health as adults. And ACEs are the basis for the primary determinant of health, social, and economic well-being for our nation, which we're going to see. So what did the ACE study reveal? Now, these are just some numbers to get your brain thinking and seeing, right? So 66.7% of individuals, so we can see 66.7% of individuals, so 2 out of every 3 people have greater than 1 ACE. It's a lot of people. Now, 25% of people have 1 ACE. 15% of people, which is 1 in 6 or 7, have 2 or more ACEs. 10% of people, or 1 in 10, have 3 ACEs. 6%, so 1 in 16 to 17 people, have 4 ACEs. 17%, or 1 in 5 or 6, have greater than 4. And 11%, which is 1 in 9, have greater than 5 ACEs. Think about that. 11% doesn't seem like a lot when you say 11%, but when you think 1 in 9 people have greater than 5 ACEs, that's huge. All right, so let's keep looking a little further. So trauma, the real terrorist in America, using CDC data, we can see 1 in 8 mothers are hit. 1 in 5 to 6 women are raped. 1 in 5 are molested under 18. 1 in 4 are physically abused. 1 in 3 experience intimate partner violence, which is 2 times more often than breast cancer. And 1 in 4 have alcoholism. And remember, these are self-reported numbers, so we have to take into account suppression and repression. People may be an alcoholic, but be like, I don't have a problem, so they don't report it, right? These are just the ones that are reported. Somebody might be raped, but not report it because they just want to suppress it. They don't want to deal with it. So again, these numbers are actually probably higher. And you can see this is a lot of people dealing with trauma, and this is in America, right? This isn't a third world country. This is America. These are the things people are dealing with, and these are our patients, our coworkers, lots of individuals in the world. So some more about what the ACE study revealed. So what it revealed is that the higher the ACE score, the more likely a person is going to be severely obese, right? So we can see percent of obesity for somebody that has an ACE score of 0 is down here around 6. And as the ACE scores get higher, the percent obese increases as well. So we can see almost a 2.5% increase between 0 and greater than 4. So some more information that the ACE study revealed is childhood experiences and chronic depression. The red is women, the yellow is men. Chronic depression is the #1 disability for adjusted life years. And what this found is, again, if we see an ACE score of 0, the percent of a lifetime history of depression is down here between 10 and 17. But as we get higher with the ACE score, we also see increased rates of depression for both men and women. And so between 0 and going up to greater than 4, we have 3.5 times greater increase of depression. Okay, and same thing for rates of antidepressant use. We can see a score of 0 is down here around 30. And if you have 4 or 5 or more ACEs, you're almost at 100. So that's pretty crazy, right? If you experience more ACEs 50 years later, you have a 3 times more likely rate to be prescribed an antidepressant. And we know, so 1 in 10 adults are prescribed antidepressants. Now, here's where it gets really interesting. So with suicide's the 10th leading cause of death in America, and it is the leading cause of death for those ages 10 to 24. We lose a child every under 13 every 5 days due to a suicide. So this is a pretty serious event in America. And we also have to remember that suicide is the leading cause of death in America, but it's actually probably higher than the 10th leading cause because sometimes suicides get ruled as unknown death. So it's actually probably higher. But what we see is, again, an ACE score of 0 and percent attempting suicide. This is very low. It's 2%. And again, as those ACE scores increase, so does the percent that attempted suicide. And if you have 4 or more ACEs, you're around 17%. So what they found is ACE score greater than 4 has a 13.4 times greater increase in suicide attempts. And if you have an ACE score greater than 6, it's a 30 to 50% greater chance of a suicide attempt in your life. So again, touching back to this leading cause of death in the United States, we can see suicide is around here for adults. So if we come over, we talked about that suicide is around I think we put number 1, but this might have changed. This isn't updated. So this is 2022. It looks like it's second for those between 10 and 24. But we can see the point of this is the unintentional injury, right? So between 5 and 44, the number 1 leading cause of death in the United States is unintentional injury. And then when we come up to 45, up to all ages, the 3rd and 4th are unintentional injury. And why this is important is that sometimes, or often I should say, suicide does get ruled unintentional injury. So these rates are actually probably higher than their current standings in the CDC. All right, so let's get back to some more results from the ACE study. So ACE score and anti-anxiety medication. So again, if you have a 0, you're around 15% of people, but if we come over to greater than 5, we are up to around 33%. So an ACE score greater than 5 has a 2 times greater chance that you will be prescribed anti-anxiety medication in adulthood. And again, what is so interesting about the ACE study is not only is it linked to what medication should be prescribed or your risk of mental health diagnoses, but also health outcomes and substance abuse. There's lots of different things, and we're going to go through that. So here's an example with smoking as an adult. Again, you have an ACE score of 0, and as your ACE score gets higher, so does your percentage of smoking as an adult. And in fact, if you have greater than an ACE score greater than 6, you're 2.5 times greater chance of being a smoker. ACE score of 4 or 5, you have a 2-time risk of being a smoker compared to those who have 0. And now let's look at alcoholism. So again, percent with alcoholism, you have an ACE score of 0, you're around 2.5%. If you come up to a 4 or greater, you're around 16%. You can see every time the ACE score gets 1 point higher, we have an increased risk of adult alcoholism. So an ACE score greater than 4 has a 6.5 time greater increase in alcoholism in adulthood. And again, let's look at drug addiction. So 2/3 of people in rehab report a history of trauma. We can see here, so people who have had a drug problem, been addicted to drugs, or injected drugs. We're showing 3 separate graphs here. And the main thing to note from these graphs is, again, when we talk about the ACE scores, you can see the colors under the ACE score. Again, it increases as the ACE score increases. Here is our relation to injection drug use. So again, when we have a percent of people who have injected drugs versus their ACE score, you can see a huge difference between an ACE score of 0 and then how it increases. If you have an ACE score greater than 4, you have a 30 times more likely to inject drugs. And an ACE score greater than 6, you have a 46 times more likely to inject drugs. This is a crazy correlation, and this is actually one of the biggest correlations in medical research. This 46 times more likely to inject drugs at an ACE score greater than 6. This is a lot. So just some more examples. We're going to start to run through these quickly because there's a lot of correlations between the ACE study and different health outcomes. So again, your ACE score and risk of hallucinations, you can see that increase. Rates of antipsychotic prescriptions, again, depending on the ACE score, you see the increase. As ACE scores increase, so do rates of hallucinations and antipsychotic prescriptions. So something else that is very interesting that the ACE study has revealed is that your ACE score is also related to things like your work performance and your development. So again, this isn't just health outcomes. So the ACE score, as it increases, so does the percentage of children's risk of having developmental delays. That's crazy. Also interesting, as the ACE score increases, it also increases the percentage of work performance in the sense of absenteeism increases with higher ACE scores, serious financial problems increase with higher ACE scores, and serious problems performing jobs increase with higher ACE scores. And again, some more charts because these are all the things that are related to your ACE score. What's interesting with this whole slide is that it is related to health outcomes, right? So in the sense of not mental health, but physical health. So we have higher rates of liver disease as the ACE score increases, higher risks of heart disease as the ACE score increases, higher risks of stroke, COPD, diabetes, sexually transmitted diseases. All of these we can see as the ACE score increases. So does the rates of these diseases. And then when we look down here at the bottom, we can see percentage of abused children, sexually abused, and number of unexplained symptoms. So we can see the higher percent of childhood sexual abuse increases the number of unexplained symptoms. So we can just see how that's related. All right. And again, there are many others. So this is the last slide with the charts, but there are just many other things that this ACE study has revealed. And really, the ongoing trend is the higher the ACE score, the more problems, right? Risk of perpetrating domestic violence, risk of later being raped, having a history of STDs, HIV, unintended pregnancy or elective abortion rates, and greater than 50 sexual partners. All of these things increase as the ACE score increases. So if we prevent ACEs, the listed problems in this chart would decrease by the percentage that you see in the chart. So rates of current depression would decrease 54%. Suicide attempts would decrease 58%. Drug abuse like alcoholism would decrease 65%. IV drug use would decrease 78%. We can just see that if we were able to prevent ACEs, the rates that things would be reduced in our society that are problematic. And that's why it's so important that we need to be a trauma-informed society if we want to improve outcomes. This is specifically for women, but if we want to improve outcomes for our society, we really need to be a trauma-informed society. And we can see that with all the previous slides that show that ACEs cause health problems, social problems, mental health problems, substance abuse problems. So some more about what the ACE study revealed. Over on this side, we have, this is in males. So this is sexual abuse, physical abuse, domestic violence, and poverty. Each increased risk for mental health problems in males. And then over on the right side is the same, but for females. When we're looking at this chart, we can see different colors represent different types of abuse. The blue is sexual abuse, red is physical abuse, green is domestic violence, and purple is poverty. So the number of individuals they looked at, so for males, it's 2,382, and for females, it's 3,310. Again, a good group of people. So the thing that is important about these two slides is something called an odds ratio. So you can see the OR equals 1.4. So an odds ratio is a measure of the association between an exposure and what's important about this is the OR of 1.4 This is the odds ratio, so the association between smoking, secondhand smoke, and lung cancer. Now, we all know as a society, secondhand smoke causes lung cancer, right there, but the odds ratio for that is 1.4. If we look at all of these things, so for example, childhood ADHD and sexual abuse, so this first one for males, the blue line, and we come up, this odds ratio is like 3.5, right? And then if we look at childhood ADHD and physical abuse, the red, this is over 5. And you can see that for all of these things, for both men and women, childhood ADHD, alcohol dependence, conduct disorder, drug addiction, explosive disorder, major depression, and PTSD, actually for all of them, the odds ratio is much higher. Some of them it's close, but is much higher than the odds ratio for secondhand smoke and lung cancer. So why as a society are we not talking about this? You can look at sexual abuse for males and PTSD. We're up over 5. Some of these are up over 5. You look for females, it's up over 6. This is a problem in our society. And as healthcare workers, this is a problem in our patient population as well as with our coworkers, within our own life. Trauma is everywhere, and trauma related to all of these different things, right? So this is something that needs to be talked about more. All right, so how can we, I'm gonna move myself over here. As a society or as healthcare workers, ways that we can help. So strengthening economic supports to family. So this can be through financial security, family-friendly work policies, there'd be more coworkers, setting up patient supports when they're discharged. We can also help by promoting social norms that protect against violence and adversity, looking at legislative approaches to reduce corporal punishment, public education and campaigns, and bystander approaches, men and boys as allies in prevention. We want to ensure a strong start for children, so early childhood home visitations, high-quality childcare, preschool enrichment with family engagement. We want to teach skills, so social and emotional learning, safe dating and healthy relationship skill programs, parenting skills, and family relationship approaches. We can connect youth to caring adults and activities like mentoring and after-school programs, and we can intervene to lessen immediate and long-term harms by enhancing primary care, having victim-centered services, or trauma-informed treatment to lessen the harms of ACEs, treatment to prevent problem behavior and future involvement in violence, and family-centered treatment for substance use disorders. So other ways we can help. So we can prevent, when we talk about children who may be in difficult situations or how to prevent ACEs from occurring, we can use a triple P approach, which is to promote positive parenting. And positive parenting is about showing children love, warmth, and kindness. It's about guiding children to act the way you want by encouraging and teaching them. It's about helping them to thrive by sending the powerful message, you are loved, you are good, you matter. And we can remember this, the acronym PRIDE. So praise, reflect, imitation, description, and enjoyment. Other interventions that can be offered include trauma-focused cognitive behavioral therapy, child-parent psychotherapy, and parent-child interaction therapy. We engage in existing programs which screen, prevent, and treat. We can network, data collect, and research, prevention and quality improvement, science to enhance interventions. And raising awareness of ACEs can help to change how people think about the causes of ACEs and who could help prevent them. Hopefully, this discussion will help you to think differently about adverse childhood experience, shift the focus from individual responsibility to community solutions, reduce stigma surrounding people looking for help with parenting challenges or substance misuse, depression, or suicidal thoughts. We can help to promote safe, stable, nurturing relationships and environments where children can live, learn, and play. And as healthcare workers, this is so important, especially with reducing the stigma and providing education for both communities and patients alike. So other ways that we can help is this is just a chart, but strengthening economic supports for families, changing social norms to support parents in positive parenting, promoting quality care and education early in life, enhance parenting skills, and intervene to lessen the harms and prevent future. So there is also the National Child Traumatic Stress Network centers and affiliated agencies that provide proven treatments to traumatized youth nationwide. And here is a map of the United States and all of the different treatment and community centers and affiliate member organization programs. And their mission is to raise the standard of care and improve access to services for traumatized children's families and communities. So again, we're providing education to patients, friends, family, whoever is needing this. This is a great resource that we can refer to as well. And this just shows the percentage of children with behavioral problems, PTSD, and traumatic stress that were involved in these centers at baseline. The blue is where they started. And at follow-up, you see the reduction of the percentage of children with these behavioral PTSD or traumatic stress problems. So their programs. All right. And if you want some more information, are the references for this discussion, but you can always look up adverse childhood experiences, Folletti. There's a ton of information. This is a huge area of research specifically in the nursing profession. I'm sure in social work and other professions as well. Adverse childhood experiences, you can find a lot of information on this in various academic journals and things like that. Hope you guys enjoyed, and thank you.